From PowerChart, navigate to the patient list. Open the patient record. The patient overview is displayed. Select the drug chart from the menu sidebar. There are 4 main sections to the drug chart: Scheduled medicines, blue; PRN medicines, green; Continuous titratable medicines, purple; Discontinued medication, grey. The yellow column represents the time now. Future administration times on the right and past times on the left. Therapeutic class view will split the chart by the class of medicine, for example, anti-infectives and cardiovascular agents. At this stage, review the drug chart to ensure the medications prescribed for the patient are correct in terms of dose, route, form, and indication. Allergies can be checked on the patient record by clicking the top left of the screen. At any time, you can right-click on the medicine and select the reference manual to get more information about the medication, including side effects, which may be useful when counseling the patient. By the patient's bedside, assess what medicines the patient requires.
My name is Patricia. I'm just going to see which medications you're doing.
Once you have established the patient's requirements, prepare the medicines. Patient medicines might be available in the POD locker, which will be indicated by pharmacy here. If medication needs to be retrieved from the drug room, tap out of the computer using the Imprivator card reader. To begin administration, click the medication administration barcode on the top right of the screen. Bring the medications, including the box, to the workstation. Confirm the patient's name, date of birth, and ask if they have any allergies.
Can you tell me your name and date of birth, please?
You will now be prompted to scan the patient's wristband.
And do you have any allergies?
No, I don't have any allergies.
A list of medications due will then appear. Scan the medication barcode to validate it matches the prescription. To achieve the desired dose, for example, if you are administering 2 5mg amlodipine tablets for a 10mg dose, you will need to scan the barcode twice, indicating that 2 tablets are required. Once administered, review medication selected, and once you're happy, click Sign. By refreshing the drug chart window, the administered dose will show as verified and signed. IV medicines should be prepared in the drug treatment room. Once prepared, take all packaging to the bedside. Scan the patient's wristband and then the medication. A yellow box notifies you that more information is needed. On the computer, enter the site of administration here. The diluent and the volume administered can also be entered here. The witness should countersign in this box by completing their name and entering their password. Once satisfied with all of the above, click Sign. When administering infusions, be sure to cross-reference the strength of the additive, the volume of the diluent, and the rate. The system will assess the quantity of medication being administered and check this against the prescription. If the quantity of the dose scanned is less than what is expected, an alert symbol will display. Depending on the patient's requirement or a dose range supplied by the prescriber, this dose can proceed. Prior to signing, you should click in the Results section, review the dose to administered, and once happy, click Sign. If the dose scanned is more than what is prescribed, an overdose warning will display. There are some instances where this alert should be overridden. For example, If administering half a tablet or portion of a vial, it would be appropriate to override this alert. The dose administered can be updated by clicking on the results section and updating the dose to be administered. The blue tick represents the prescribed dose matches the dose being administered. If a medication scanned outside of the time frame, this alert will display. If the barcode doesn't scan or is unavailable, you can manually select the prescription by clicking the tick box to the left and manually override the scan. Please note, manual medication administration should only be used when necessary, as it overrides all safety functionality of barcode scanning. To record a medication as not given, from the drug chart, right-click on the dose and record Not Done. Alternatively, you can record the medication as not given in the medication administering window by ticking this box.